I'm going to put you guys on mute. Okay. Good afternoon. My name is Alicia James, and I am the president and founder of the PAM Project. PAM Project is a social enterprise which advocates for Black mothers and their mental health. The acronym of PAM is Preserve a Mom, and the whole premise of the PAM Project is to address stigma in the Black community, as well as encouraging mothers to be mentally and physically well. Today, I am very fortunate to have three Black mothers who happen to all be from Long Island to discuss their role and addressing the public health issue of COVID-19 and how their role plays a part in helping the public to be well. And I'm very fortunate today to have Retha Fernandez, who is the newly appointed, I will say, Chief Diversity Officer, Inclusion Officer for Suffolk County. And she's also the founder of Soul of Long Island, which is her private business and addresses meditation and wellness for Long Islanders and beyond. I also have the pleasure of having with us today Dr. Angela Banks Jordan, who more than 18 years in nursing, currently has her doctorate. Congratulations on your new accomplishment. As well as she is, I want to make sure I get this right, is the nurse administrator for Northwell Health Systems. I have another guest who will be coming in a little later, Janice Thompson, who has been working in the nursing field for more than 30 years. And I'm super excited to have these three ladies join me in a conversation so that the public can have a better understanding what it's like for them and their role in helping us to be able to shelter in place while they're saving lives and helping the public. So I wanted each of them to take a moment to go a little more into detail and talk about their role and what they're doing. And so we can appreciate them even more than waiting till 7 o'clock and celebrate them. And so first, I want to introduce Retha and tell us about what you do in your role in Suffolk County and beyond, because I know she wears multiple hats.
Thank you so much, Alicia. You can hear me fine?
Yes.
Great. Thank you for being here, and thank you for your platform, the PAM Project. I know that it is beneficial and helpful to so many moms and their families. So thank you for that and for inviting me on. So yeah, my new role is Chief Diversity and Inclusion Officer for Suffolk County Government. And what I am charged with is helping to have the workforce of Suffolk County government reflect the residents of Suffolk County. And I'm very grateful for the opportunity to be able to do that, or at least help launch that. I'm also a certified meditation instructor. I practice and teach primordial sound meditation through my company, Soul of Long Island. And I came to that as a result of stress, like most people do, come to meditation because they're stressed out. And so I went through my own personal journey with stress, a spiritual journey. And once I learned the practice and began practicing it myself, I said, this is something that I want to bring and offer to community. So I do that through my company. So, and I also volunteer with many organizations. The three biggest ones I would say is I am a member of Jack and Jill of America, Suffolk County, which is a mother's organization whose mission is to nurture future African-American leadership, so our children. I serve as the vice president of the Suffolk County chapter. I'm also still very much involved in the State of Black Long Island Equity Council, which is the racial equity project launched by the Urban League of Long Island under the leadership of Teresa Sanders. And I'm also a board member of the Women's Diversity Network. So those are three, in addition to being a wife, mother, and everything else is where I spend the most of my time. So I know, should I continue or you want me to?
So yes, I want you to speak to your current role,
Okay.
and I want people to understand, because I know that you're not per se on the front line, but the role that you play
Okay.
with, that we spoke about, the CSR. I want people to understand the role you play, because it is very important that people understand your position. And also, I want those who are able to listen and watch us live to also maybe take some notes from Suffolk County, and implement what your role is, and beyond. So for the public and private sector to
Okay.
follow, your lead. So
Great.
please share that.
Sure, sure. So my announcement happened in December. I was confirmed in February, and I started in the office on March 2nd. So I was in the office for 2 weeks because then we had to close on March 16th. So what a way to start a brand new position right at the start of a pandemic. So since then, I have been working from home, schooling from home. Um, throughout I would say, the latter part of March, work had been around helping to identify um, employees that were essential and how we were going to make sure that we had everything that the employees need in terms of time off, how we were going to figure out how to put employees in different, or have them help out or be loaned out to other departments to help with the pandemic. And most of the employees, most everyone was willing to help wherever they could in whatever other departments, like the Department of Health, the Department of Labor, things like that. Most of the employees just pitched in, as it were, to address everything unknown that we needed to address. During that time while I was home, a lot of my friends and the people that I know were asking me to offer meditation. So to Retha, you should go on live and you should do meditations, or, go on Facebook and do meditations. People really need that. And I agree, people did and still do really need that. But at the time, I did not have it to give. So I said, I can't do it right now because my own feelings of paranoia, of fear, of trauma, of, being tired of seeing death announcements. I had to come off of Facebook, stop watching the news. I was calling Facebook death book. I was worried about friends and family that had positive tests and they were struggling. So I just didn't have it within me to give to others. And
I think I want to pause and say that is so critical for people to understand that everyone's mental health wasn't on the same level, and that we as individuals needed to start processing. I think that, the first week when we were sheltered in, it was kind of like, okay, we have a little time out. But when the numbers of cases started to increase, the death toll numbers started to increase, it became even more real. And, I'm glad that you did do that for yourself and give some pushback so people could really understand that, your own mental health needed to be checked, and that they also should have examined themselves, right? And that this is a new norm, and I think it is still taking people a long time to get to that place. But I'm glad you pointed it out. Something you mentioned, I want to just go back to about the employees, who's essential workers and who isn't. I think I asked you this before we were speaking, but was there any pushback when you had to assign people to be essential workers that weren't previously?
I would say that there was a little bit, right? Because people were feeling the same as I was feeling, paranoid, nervous about entering into, well, do I have to do this? Do I have to go to the office to do this? Can I do this from home? Do I have to go to another place, another training center in order for me to be trained up to do this? Can I do it from home? So there was that natural hesitation and pause because they didn't know and they were afraid. That
Right.
was the biggest type of pushback that we received.
Right. Right. And so now that, you've crossed over that hurdle of assessing your own mental health, and now tell me what it looks like now for you, that providing the wellness for the public.
Yeah, so it took some time. I had my godfather passed from complications of COVID on April 7th.
Sorry.
And thank you. So that was devastating for our family. And then I think I would say the next week or so, I was still getting the requests to do meditations. And I said, okay, Retha, you have to snap out of it. You have to, people are wanting something else, something that you can offer, something that you say is, your purpose and part of how you serve. So get it together, girl.
Right.
So I did my first meditation offering as part of the Women's Diversity Network Summit. So I did that on April 18th.
Okay.
And then shortly thereafter, I volunteered to offer meditations for Suffolk County employees through the county executive's behavioral health wellness initiative. So this was something that was launched out of his office to offer employees. And it happens every day. I do a 30-minute meditation, but the offerings include offerings from mental health professionals, healthy cooking, like mindfulness activities, drawing, things like that. And the employees can join, all or none if they want to. And then a couple weeks after the program launched, the county executive decided to and said, let's offer this to the public. So
wow.
Yeah, so I thought that was really wonderful. So not only the employees of Suffolk County, but the residents of Suffolk County and everyone, because it's free on Zoom, can join in and receive some of those benefits. So I consider that another honor to be able to offer and serve in that way.
Thank you for that. So can you, before we discontinue, can you tell us where they could find that information and take advantage of it?
Yes. So go onto the suffolkcounty.gov website, and you have to scroll down because on the top of the website, we have a lot of information around COVID, but scroll down a little bit and you should be able to find the links there.
Okay. So I'm going to come back to you later. So Angela, if you can tell us more about yourself, and I know you have a lot to share. I know you do, but I really am excited that you and Janice can share your stories and tell us what it's like to be on the front line. So tell us about yourself,
Okay.
and then, yeah.
Okay. You can hear me okay?
I can hear you fine. Thanks.
Okay, great. So good afternoon, everyone. And Alicia, thank you so much for having me. So I am Dr. Angela Jourdain, the newly became Dr. Jourdain. I just completed my doctorate in public health. My dissertation actually focused on trying to explore variables that we could address in practice that would decrease the morbidity and mortality of minority women in particular who see more complications related to ectopic pregnancy. So my clinical background is not OB, but I became very interested in this topic when I started researching just a lot of health disparities that span across the underserved, particularly lower socioeconomic well as ethnic groups. So, I'm sure everyone has heard that COVID-19 seems to be impacting communities of color, far greater than other communities. But I'll put that to the side for now.
Right.
So, just to share a little bit about my background, I've been a nurse now for 18 years. Prior to becoming a nurse, I worked for the Food and Drug Administration as a consumer safety officer. My clinical background in nursing is surgical trauma and neurosurgical intensive care. I completed my master's in nursing administration and informatics. I have a bachelor's degree from Spelman College, and I'm a graduate of the Phillips Beth Israel School of Nursing. So part and parcel why I wanted to share what my educational background is that in my current role, as you mentioned earlier, Alicia, I currently serve as a nursing administrator for the Northwell Health System. I currently work at Glen Cove Hospital here in Long Island. And so most people are kind of curious, well, what exactly do you do and how are you really on the front line? So, as I hear everyone talk about, sheltering in place, I'm not really sure what that looks like or really what that is, because from day one, we have been at work. Um, so what I do in my role is I support nursing administration. I actually serve as duty administrator for the hospital. So
Okay.
I cover all of the clinical areas within the facility. So I work very closely with the nurses in the intensive care unit, in the emergency department, in our rehab units, and our telemetry and medical surgical units. If there is a cardiac arrest or rapid response where somebody's not quite in cardiac arrest, but they're having some distress, the goal is to save them before it progresses there. So I am there on the front line, right alongside with the nurses. I'm there to support all of the staff. I touch every department in the hospital, from housekeeping to security to respiratory therapy. It's a team. It's very intense. And the last thing that I wanted to share, because I want to give the opportunity, to make sure that we have enough time. But at the height of the COVID-19 pandemic, I became infected with COVID-19.
Right. I
And
want to speak to
I'm
that
going to
separately, but I'm glad you
okay.
shared that, because that is one of the reasons why I wanted you to come and speak, because you contracted the virus, but and you recovered and you went back to work. And I think that
Mm-hmm. Thank God.
yes, thank God, many
Thank
people
God.
who are um, questioned, like, how could you go back to work? You put yourself back out there, and people are, taking the antibody test, and we're still not sure if you have antibodies, that mean, can you get it again, or all these questions that the public are asking. So for you to be on the front line and had the virus, shelter, you were quarantined at home, right, with your family, and you return back to work. And so we thank you again for that. And
Thank you.
Janice is now with us as well. Well, one of the questions I wanted to ask, um, before we introduce Janice, I want to ask all of you is, how have you been able to balance your roles, and since this pandemic started? So Janice, I want you to, now that you have joined us, I want you to take a few moments to just tell us a little bit about yourself, and the role you're playing at the hospital. I know you are currently working at Kingsborough Jewish Hospital. Can you tell us about your work and your role there?
Kingsbrook.
Thank you for the clarity. Thank you for that.
Sure. Good afternoon, sisters. I want to give thanks to our Lord and Savior for today, and I'm honored to
Amen.
be able to share my moments. I've been a nurse for over 30 something years. Started off at Beach Terrace Care Center, where I've been experienced with Alzheimer, dementia, psych, and hospice. Hospice was my passion. Um, I retired from there 2017, and now I'm working in Kingsbrook Hospital, where it's a different settings, but I like it. But today, this epidemic that we are faced with, um, it's a little different now, because if something is your passion and you become these patients' family, actually their family, and they look up to you every day. They know your name. You know you can communicate with them. You can just have a relationship with them now. And now that I'm at the hospital and this epidemic, this COVID, it's a different feeling. You enter into their rooms. It's like, where you, Mrs. So and so, you used to having a conversation with them, but now the anxiety, the stress level has, just hit the roof. You don't know really what to say. All you know is you just want to do what you have to do and come out of there. It's hard, but the workers that I work around, we survived through this crisis. We caucus every day. We share things that we go through, and even leaving the hospital, going home to our families. That's the scary part. But I myself, I was a person who came across the virus in April, and I wasn't positive. I was negative, but I had symptoms, and I was so frightened because I had to quarantine myself from my children, from other family members, and especially my dad. But I came through it. I did go back to work after 15 days, because this is something I just wanted to be there with patients, because you have to remember something. These people, all we that they see is us. They can't be with their loved ones. We have to,
Right.
be
That's
there.
right.
We're in the
Mhm.
ER. We have to hold their hands. We have to support them during this crisis. And I have been with people that have died. It's very emotional for me, because just see their faces, and they're sick, they're on respirators, oxygen, and they can't talk to their loved ones. They're sharing memories, they're sharing things that they usually share with their loved ones. It's very hard.
Right.
And just to know that on the media you hear them talking about, what they're doing at home, exercising, cooking, but you never hear how first line workers are really feeling. You
Right.
really, really don't know, because you pass by people there. Oh, how you doing? But you really don't know. You really
Right.
don't know.
And I'm glad that you're saying that. And this is one of the reasons why I'm having this discussion, so people get to hear your story and get to hear Angela's story, and you have, as I said before when we started, that we are humbly appreciative of you guys getting up every day, knowing what you're going to face, going to work, knowing what it's going to look like for you. And so, Janice and Angela, we and you are so appreciative of you and your colleagues, your coworkers, and everyone that works on your team, because we, I couldn't. And many people that are struggling with their anxiety as they're sheltering in place, we think you are beyond superheroes. And so, Janice, you mentioned about your health and being a support to your dad. I want to flip it back to Angela, because Angela, you did have the virus. So can you share what that experience was like for you and your family?
Okay, thank you so much. And Janice, thank you so much for you shared a lot of sentiments. So I'm just gonna apologize in advance if I get a little emotional.
It's okay.
Mhm.
So um so at the end of March, the very beginning of April, So I suffer from seasonal allergies. So I was first having some allergy, typical allergy symptoms that I always have about this time of year. So probably after a couple of days of, treating my seasonal allergies, I noticed that I woke up one morning and I had some, chills, but I didn't think anything of it. So then the next day, which was actually on April 1st, so this was no, I woke up, I had chills, and I had these excruciating body aches. And anybody who has been positive for COVID-19, there are certain symptoms that they will, and the body aches is one of them. But on top of that, I developed a temperature of 102.3. So when I took my temperature, because I felt very warm, it was at that point, without even being tested, that I knew that I was positive. So I, called my employee health service because I was actually scheduled to work that night. So I was advised, of course, to, quarantine myself and go get tested. So the next day, I was able to get an appointment, and I went to one of the Northwell Go Health Centers, and I was swabbed, which was an extremely unpleasant situation. It's interesting. I have so much more respect for patients when you become a patient. It's different when you're on the other
Exactly.
side. But my husband was like, "So what was it like?" And I said, "I felt like someone shoved my hairy gray cat up my nostril." I'm extremely sensitive. So I kept, pushing the doctor's hand away because I have like hypersensitive reflexes. But anyway,
Mm-hmm.
thankfully I survived that experience. But then over the next couple of days, my symptoms started to progress. So I had already shared this with Alicia, and I just want to share this. So what I did, I told my family, I'm very blessed that I'm a member of two dynamic sororities, Delta Sigma Theta Sorority Incorporated and Chi Eta Phi Sorority Incorporated. Chi Eta Phi is an organization of nurses and nursing students. And those of you that are familiar with the Divine Nine organizations, Delta Sigma Theta is very diverse. We have members who are from all professional background. So of course now, when you tell a bunch of nurses and you tell a bunch of deltas, what's going on, you talk about some people that will rally behind you.
Your
But
village.
tell people that I was, yes, it's like oh my gosh, it's like the world, the universe. I did share with both of my organizations, with my family, to let them know when I first started having symptoms. And then when I tested positive, I did share that. So you wanted me to talk about what it was like. So
Yes.
um, first of all, the prayers. When I tell you that pouring of concern, and I think also too, people were so worried because we hear these stories about people who are seemingly healthy, and then they just go downhill very quickly. So and for me, I was not necessarily, but of great concern for me was obviously my family. I have two daughters, and I think my biggest fear was infecting them, of course, but I have a 19-year-old who is on the autism spectrum, who is not conversational.
Okay.
So if she were to get sick, she really would have difficulty sharing with me, everything that's going on. So I really had on changes in her behavior, and what she is able to tell me, should she have become sick. So I was definitely afraid that I was going to infect anybody in the house, but her in particular. Um, Over the next couple of days, I started to have worsening symptoms. When the doctor called me the Tuesday after I tested that I was positive, when she shared those results, I didn't even have insight that I was short of breath, because at this point there were other things going on with me metabolically, which I'll share shortly. But the doctor says, Ms. Jordan, I could hear that you're short of breath. I did have a cough that was developing. She just, told me that she was going to prescribe an inhaler for me. But
Right.
I didn't even realize that I was starting to become short of breath.
Right.
So the next day after I got my result, my husband, thank God for him, my husband said to me, I don't know what it is about you today, but
Mhm.
you smell like you're sick. And
Wow.
I really wasn't quite sure what he meant by that. And he wasn't even sure what he meant. And one thing I'm just going to say about my husband did not wear a mask the whole time. My husband bathed me. He had no problem. I'm like, honey, go get my sugar scrub and I need to, get exfoliate. My husband scrubbed me down and he slept in bed with me the whole time I was sick because he said, God forbid, if you stop breathing, I want to be able to know and something about it. He was not going to leave my side. He was so worried, but tried so hard not to let me know how worried he was. Um, so in the midst of everything and just starting to notice that I was becoming increasingly weak, I started to become more short of breath. But because I know and I see what goes on in the hospital, as Janice said earlier, these patients are there alone. There's no support system. So we become their support system. So this is the reason why we get up and go to work every day. Because if we're not there, we're the surrogate, and people say, well, this is what you signed up for. No, this is what I was called to do. And when God
Right.
calls you to do something, He will provide for you, He will take care of you. So this is not about, it's not about me. So my strength comes from God. That's how I get up and do what I do.
Yep.
So at this point, I started to become really sick, really should have been in the hospital. I recognized that I was becoming severely dehydrated. I then started to develop renal insufficiency, meaning my kidneys started to fail. And again, we all know, right? I don't know about anybody else, but as a nurse, when I go to the bathroom, I always check, in the toilet, what's there, just to make sure that I'm healthy. And my urine was dark brown,
Wow.
like Coca-Cola colored. And that's so my husband said to me that I smelled sick. That's what was going on with me metabolically. I started to become disoriented. I was confused because my electrolytes were all out of whack. My skin started peeling like I was a snake. I lost 11 pounds in the course of 4 days. Um,
Wow.
I started muscle wasting because I was coughing so much. Anything with a salt or anything like just would make me cough. I couldn't eat. And I really needed to go to the hospital. But I just said, God, I'm going to try to resolve this myself because I really wanted people who were really sick that needed to be in the ER and people in a hospital bed, not me as an employee, but as a nurse, I recognized what was going on. And basically I said to my husband, I need you to find grape juice, orange juice. We had plenty of water. People were bringing food, all sorts of things to my house, water, everything, tea. So I just began to drink and drink and drink and drink. And then I
Let me just
cleared
pause and
urine.
say one thing.
And
I
yes.
just want to. I want you to continue, but I just want to stress this because people are watching. And I said before, as a nurse, I know you made a decision to stay at home. And some people are like on the fence, like, should I go to the hospital? Am I
Mhm.
safe to quarantine at home? Your situation, I tell you, God had you covered
Please don't do this. Yes, yes, yes.
because you
Hmm.
had your husband with you. And
Yes.
again, it's
Yes.
so important that people understand what their village looked like. You had both
Yes,
sororities helping you. You had friends, you had family, you picked the right man to be your husband. Okay. You you had listen, all the work that you do paid back because you had a team, you had a squad making sure
Exactly.
you stayed
yes. I had a
alive.
squad. Yes,
And so, but
yes.
you took a chance staying home, Angela. As I listened to you and everything that happened with
Yeah.
your health, you took a really you took a chance with your life. And
Yes.
I guess as a
And a
nurse,
lot of people do that. Yes.
as I'm rehearing the story, I want to cry because I'm like, oh my God, you really put
Yeah.
your life on the
It was
line
scary.
to be home.
I did. And
So
when
finish,
you talk about your mental health,
right?
yeah. So that's something that I'm like angry. I'm still angry with myself about. So I'm not really talking to myself because I'm mad at me. because I did. And someone said, well, why didn't you just call one of us to come and put an IV in you? And we would have, and I said, because I didn't want anyone to come to my house and see how sick I was and tell me to go to the hospital. And honestly, truthfully, it wasn't that I was afraid, of what was going to happen to me when I got there. I was mostly afraid that, my family, my husband wouldn't be able to stay with me should I be admitted, which I knew I would have been.
Exactly.
And then he would have been so worried. He would have been so worried. But, and even though I, would have gone to the hospital where I worked and possibly would have been allowed some privileges, I'll just say it like that. My husband was needed at home with my girls to support them. So, and we have a cat and a dog, and he needed to just be home with the family. But yes, my situation is very unique. I will tell people in a heartbeat, please don't do what I did. And I think, unfortunately, a lot of people think they can wait it out. And so, for me, I was fortunate that I was able to recognize what was going on with me metabolically. Most people would have just been like, okay, stay in the bed. And most people probably would not have even shared, the symptoms that they were experiencing. And I think that's the other thing. And some people, they don't even know what's going on. They just think I can just drink this, take this, stay in the bed and rest. But I recognized that I was really in trouble, and I knew what I needed to do for myself. But I made a deal with myself that I didn't feel better over, by the morning that I was going to go to the hospital. And thankfully, when I recognized that, my kidneys and I just metabolic breaking down. And once I started, increasing my oral intake and clearing out, everything, impurities and getting my electrolytes back together, I saw a turnaround. So I'm very fortunate that things worked out for me. But I would tell people, like, don't take that chance.
Right.
Especially, again, anybody, whether you're a medical professional or not. And, because especially when people have comorbidity, like, we hear a lot of diabetics are really succumbing to the disease. And like what I described, I'm not a diabetic. Thank God thank God, very healthy. But for somebody who does have a comorbidity, those things happen a lot quicker. A diabetic cannot go without their medication, cannot go without eating. And, trust me, a lot of my symptoms would have, if I were diabetic or had some other sort of, immunocompromised state or something else, the course would have been very different. But I'm very fortunate that, again, I had a village to support me and nurses checking on me and asking questions. And I was able to monitor myself, but I was so weak. Like I said, my husband had to help me out of bed that day. He said that I smelled sick, and I had to stand in the shower, and I couldn't even lift a muscle to even, like, wash myself. My husband just was like, come on, I got this. And like I said, people checking on me and, telling me, drink this, take this. And it just was, like I said, it's very different when you're the patient. And because I see how sick these patients can get so quickly, I just said, Lord, I know you got me on this, and whatever your will is. And, like always, I made a promise to him that if I pulled through, and was restored to my full health, that I was going to go right back out there and be an even better nurse, and even better advocate for my patients and their families during this pandemic, and to be there to support my colleagues.
Let me just speak to when both you, Janice, and Angela, when what was it like to return to work? Because I have spoken to people who are in the medical field that, they had some symptoms, their doctors advised them to quarantine at home, and their anxiety kicked in. And some were, if they were past age 55, saying, I think I might want to retire because the death tolls continue, the cases continue. And what was that like for you in terms of your mental health? How did you prepare yourself to say, I got to go back to work? What did that look like? Janice, you can start, and then Angela, just tell us briefly, how did you have to go through the motions to return to work?
After being home, and Angela, I can relate to a lot of things that you said, especially when you were talking about not going to the ER. And a lot of people refuse to go to the ER just because, after hearing the media about the respirator, oxygen, because that's really basically all they were doing for you in the ER. So if you had other underlying problems, it's a chance that you might not come through. On the grace of God, there was a 99-year-old woman, which y'all probably saw on the news. She came through it. She didn't go to the hospital. She came home and she quarantined herself with ginger, uh, tea, and other things. I have a friend. He was
Well, Janice, I just want to just pause. Can you just speak to, because we have 15 minutes left. I want to speak to what it was like for you in terms of mental health, because a lot of people are really wrestling with, as they're watching you guys return to work, what is it like? Like, how did you have to prepare yourself?
After I went back to work, they had problems with the PPEs, but I made sure that I protected myself, and I shared with my other coworkers. But when I entered into a resident's room, I just put in my head that, I'm going to do it all that I could, not out of fear anymore, because I've been down there. I've been down that road already. I went in there and I did what I had to do. I didn't give up. I said, you know what? I'm here for a purpose. Okay. I'm not going to work in fear, because once you show that anxiety, once you show that stress level, all that goes up and it plays on your immune system. So I just went in there and I did what I had to do. I just started caring for my residents and just acting like COVID, you're not going to win. You're not going to take me down again. And I just protected myself with my PPEs, and I did what I had to do with hand washing, my mask, gloves, and my other, medical necessities that I had. And I still, this day, I still do it. And it's 5 other co-workers that I work with at Kingsbrook: Lee, Spencer, Fuller, Sophie, and myself. Every night, we all work together. And we hear, you know how when you hear in the hospital, code 99, they bring in somebody or somebody died. And right then and then, they send them to my unit. My unit is the COVID unit. As we speak, my unit is the COVID unit. But I don't work in fear anymore. I don't, because that pays a lot that pays a lot on you. It puts weight on you. Right. So I do what I have to do, and I make my day. And I don't want to show those patients that, you know what,
right,
I'm afraid anymore, because they see your expression on your face. They see, and then they act out. But we protect them with the mask. And we wear masks. But that's something I just want to share,
Thank you. Angela, what was your process?
So for me, mentally, I was really afraid of the fact that, because again, we know so little still about this wicked virus, as I call it. I actually refer to it as the monster. Right. So I was, number one, concerned. My biggest concern was I still shedding virus? Okay. Because, and again, there's no research. So although I see symptoms, I was about 5 days post symptoms before I went back to work. So that was my biggest concern, because again, we still know so little about the virus. So my concern was, even though and we're very blessed in the Northwell Health System, we have ample PPE, we get ample support, but I was really concerned about, am I still shedding virus? And if I'm even, no matter how careful am I gonna, get to anybody? Just before I move on to the rest of it, I just want to say, as I said to you guys before, my husband slept in the bed with me, bathed me, no mask. However, my husband was tested last week for antibodies, 0. He is negative. Wow. So that means, although I credit him, but I credit myself for being the super awesome nurse and wife, because I was super careful in, practicing, my social distancing and my proper hygiene, to ensure that I did not transmit this. So I pat myself on the shoulder with that. The other thing that I was, as far as my mental health, again, I feel very fortunate that where I work, there are a lot of resources for us. We have called the Lavender Room, which is set up for staff to go and just relax and separate. And so, lavender is very calming and soothing. So the room is filled with the aroma of lavender. There's tea there for the staff to just kind of kick up. But as the administrator in a hospital that's very busy, I don't get to do that often. But when I first went back, I did have to do that just so I could meditate and just ask God to give me strength. But the other thing too, and I just want to shout out my CEO, Michael Dowling. There's a quote when you first walk into the building by Michael Dowling that's actually pasted on the wall where they have like snacks and stuff set up for us, just to take it well. And it basically says that, that we will continue to fight, that we're not going to back down, we're not going to wave the white flag, and that we're going to win. So coming into this sort of atmosphere, knowing that I am supported by my employer, by my colleagues, my mental health I felt strong. I really felt like the superhero in a cape. But the other thing that I was worried about was, being stigmatized. Like now I have this scarlet letter on me. And how are people going to be? Are people going to be afraid to be around me? Are people going to treat me differently? Because I see how sometimes people, oh, we have a COVID positive. But I was worried, were my colleagues going to look at me differently? And, so other people who shared that they also recovered from the virus, we actually hugged each other. We know we're not supposed to, but we forget, we had it already. So there was also that to deal with, that I don't want to say relief. It's like, okay, we got it over, we recovered. So that fear of being infected, initially infected was not there, but there's still this chance that we might be able to be reinfected. But because again, I'm just even that more careful. But I feel that because I don't have that same sort of fear about becoming infected, my mental health allows me to go to work, be supportive, and like I said, just really be a great resource for the patient and their families.
Thank you so much for sharing that. So, Rita, I want to ask you, since we're focusing on, and Angela, I think that what Northwell has provided for the staff at Glen Cove is amazing. The room for you to be able to meditate, relax, and just breathe easy. I hope that anyone that is working in the hospital will call you, will reach out, will take notes and implement it at their hospital so that those that are working in the front line can have that same room space at their hospital. So, Rita, is there any suggestions of what people can do in terms of wellness? I think Angela's suggestion that what's happening in the hospital is great, but can you recommend anything that folks watching can do in terms of their mental health or wellness?
Yeah, well, you know what I'm going to recommend. I'm going to recommend meditation. And that can be a scary word for many people. So I like to say also any relaxation technique of your choice. So that could be a physical activity. It could be cooking. It could be gardening. It could be coloring. It could be sewing. It could be knitting. It could be dancing. Whatever sort of relaxation technique that that brings you joy when you do it, I would recommend it. But meditation, I feel, is so important for many reasons. Of course, there's the physical benefits of meditation and the spiritual benefits of meditation. But I think an important part of it is the aspect of brain training and breath awareness training and present moment awareness training that it is if you practice every day. And so what I mean by that is if you just practice taking deep breaths for 5 minutes a day, okay, maybe 5 minutes might be too long for people. Let's say 3 minutes, right? So 3 minutes at a time, just sit with your eyes closed or not and take long, deep breaths, inhaling and exhaling just for 3 minutes. that can be extremely beneficial for you because your body will, you will instantly feel relaxed. And what happens is the more that you practice it, the more that you can access it during times of stress. So it will become a natural response for you when you're in a stressful time. You will remember to stop and take some deep breaths. And that takes your body out of the fight or flight mode and into a more relaxed state so that you can be more productive. How it's helped me is so many different ways, but a great example I always like to use is I had frozen shoulder a couple of years ago, and when I would go through my physical therapy, the pain was unbelievable, and it was my breath and breathing practice that helped me through that pain and helped me, through the full range of motion for all of the activities. I've even had for procedures, doctors say to me, "Wow, you didn't flinch, you didn't move. People would be screaming right now." And I'm like, "I'm just taking deep breaths. I'm just taking deep breaths." So that is something that is easy for you to try. And then meditation, of course, now there's so many ways for you to start a meditation practice. There's apps, Headspace, Calm,
Yes.
Insight Meditation. There's guided meditations on YouTube. You Google guided meditation, and you can find any number of resources for you there. Some meditation teachers that I love is Deepak Chopra, of course, because I trained with Deepak, so Deepak Chopra. And also David G, Davidji, all one word. He has great guided meditations also. So, that's what I would offer in terms of a start.
I think that's thank you so much for those suggestions and those resources, because regardless of where we are, we're sheltered in place or we're working, what you guys are on the front lines. When this is over, and I'm not expecting to be over anytime soon, we're going to have to reassess our mental health. I think, and encourage everyone to take advantage of the state offering of the 844 therapy number. It's for emotional support. It's free to the public. But I just wanted to also have you each say one thing that you would charge the public with that they can do, because we want you to at one point get more rest and not have to witness firsthand so much death. And so I'll start with Retha, and then Angela, and then Janice can finish. One thing that you would like to say to the public that they can do.
It's hard to choose. So
Sorry.
Take a social media and news break daily.
Angela?
The key thing that I just want to say is it's okay to not be okay. We don't have to do it all. The house can be a mess. You can order out every night, but it's okay. And there's that expression that with the airplane, that you got to put on your own oxygen mask first before you can help somebody else. But if you're not okay, that's okay, and it's okay to ask for help, and just rest and try to find. I know you said one, but it's kind of all tied in. Try to find things, like I was saying, like I love shoes and retail therapy and all that stuff. And it's kind of limited with that, but I try to find at least 3 things every day to make me feel good. And they're not even all big things, but some days I'm not okay. Even if I just say, you know what, today's my not okay, then that just helps me get through. And when the time is right, I'll seek, counseling if need be. I don't need to wait, but yeah, the key thing, acknowledge it's okay not to be okay. And you know what, ladies, especially us, especially as Black women, we can ask for help. Sometimes we're the ones that need help, and that's okay. It's okay to let people help you.
Janice, you got one thing?
Reconnect. Don't take
Yes.
today for granted. Reconnect. Love one another. Check on your loved ones.
Yes. Yes. I thank you guys so much. I think for me, who has been sheltering in and doing this advocacy work from the comfort of my four walls, that we are, as a country, as a state, now we're all in New York State, we're not ready. There are so many people who are not sheltering in, who are not, excuse me, we are so many people who are not social distancing right now. There are so many people that are not respecting public space, personal space, correct? And that we need to get that right. I know that the governor and the mayor here are increasing the number of tests people are taking. I am aware that there have been more resources available, but when I look at Long Island, when I look at Nassau County, and the numbers are increasing, when I look at the Bronx, and the numbers are increasing. And then beyond New York, when I look at Texas, the numbers are increasing. And just in respect for the work that Janice and Angela, that you guys are doing, the public needs to be aware that they can take ownership of where they can help the situation to improve by doing their part, by staying home, by if they have to go out, wearing masks, being respectful of space, being respectful of people, and distancing themselves so that we are all healthy. This has been an amazing presentation. I have another one scheduled for next Saturday, which is going to be focused more on maternal wellness, where I'm introducing a doula, as well as a maternal therapist, as well as mothers who have experienced dealing with depression. And I just want to thank you so much for this. And I hope that those who have been able to join this live discussion will be able to take a lot of notes from what you've offered. And I know that Angela, Janice, and Retha, that there's so much more you could share. But we have this hour. And I hope that, you all have the resources that you need to stay well and thrive. And God bless you for so much that you do for the public. Thank you so much.
Thank you.
Thank you.
Thank you, Alicia, for having
Thank you,
us for
cousin.
this presentation and the
Yes.
opportunity.
Yes,
Rita
thank
and
you so
Angela.
much.
God bless
Stay
you.
well.
Stay safe.
Take care.
God bless.
You
God
too.
bless.